Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And today, before I introduce our guest, we're going to do a brief COVID update. The community levels nationwide, as you'll see on the screen, are pretty similar to what they were 2 weeks ago. You can see the difference noted. In New Hampshire, we just have Coos County now that is at a medium transmission level. If we go next to the New Hampshire slide, we can see again we have Stratford County and Coos County at the medium transmission level. You get a little better view of the state. Last week, 2 weeks ago rather, you could see that there were 3 counties in the medium transmission. But if you look really carefully, you can see the adjacent counties in Maine. Oxford County is in high transmission. And you can also see that our neighbors to the south in Massachusetts are in medium transmission. So COVID is still very active in our communities, and we do ask that people take precautions, stay home if you're sick, get tested if you're having symptoms, and do all those things that we've been talking to you about for many, many, many months. But make good decisions about socializing and exposing others in your family and your friends if you are symptomatic. Just on the medicine front and research front, we have a new booster available. You can protect yourself against Omicron, which is the new variant circulating, and the original strain of COVID-19. New Hampshire DHHS recommends 3 months 3 months after infection or vaccination to get that booster. And right now, if you do try to get a booster, they are available in some of the pharmacies around the state. The updated COVID boosters, when to get it, I just talked about that, and who should get it. Anyone over the age of 12 are eligible for the Pfizer booster, and adults age 18 and up are eligible for the Moderna booster. So again, kids 12 and up, Pfizer, and then if you're 18 and up, you can get Pfizer or Moderna. So it's still spreading COVID. It's not too late to vaccinate. My sign that I set up every week, please, please, please encourage family and friends. If they have not taken the steps to get their primary series vaccine, it's still a good time to do that. A short update on monkeypox. What do we know? Well, we've had 10,733 cases identified in the United States. We've had 22 reported cases in New Hampshire. Monkeypox spreads through close personal contact. There are prevention measures that can be taken, so please look online for those. Notify your primary care physician if you suspect that you have monkeypox. Some of the symptoms include fever, headache, sore throat, swollen lymph nodes, and a rash. And we have a quick picture of the rash for you. It can appear in the abdominal area and on the hands. Sometimes you can see it as well. So again, good hand washing, any close personal contact with someone that has monkeypox, or if you've been exposed to monkeypox, call your provider to get tested. The Jynneos vaccination is being given around the state. If you are interested in the Nashua area and are underinsured or uninsured, you please call the health department at 603-589-4500, option 2, and we can connect you with a vaccination. And those are now available for people pre-exposure to monkeypox and those at high risk for getting monkeypox. And without further ado, I'd like to introduce our guest, Patrick Henry. Welcome, Pat, to our show.
Thank you, Jane. Happy to be here.
I'm glad you're here. Pat is our Emergency Preparedness Coordinator, our Public Health Emergency Preparedness Coordinator, and you are here because September is?
It's National Preparedness Month.
Right.
A very important month. In my opinion, the most important month out of the year.
Oh, and I thought it was the most important month because kids go back to school.
That's very important too, but with kids going back to school, they need to make sure that they're prepared, so it goes hand in hand.
So it works really well. So
does.
It is National Preparedness Month, and this year, this is done by ready.gov.
It is, yep, which is a a website that is run through the Federal Emergency Management Agency, or FEMA.
FEMA,
Yep.
okay, and I'm sure a lot of our viewers have heard of FEMA. And this year their theme is Protect Your Legacy.
It is.
So we have a little picture, and
Yep.
so I'm thinking, I didn't do the marketing for this, but but Protect Your Legacy is really, it's your family and your generations, and how do you make a plan
Absolutely.
to stay prepared. So I was poking around the websites today in preparation for this.
Of course.
So before we get started on preparedness, you work at the division. Obviously, we work very closely together, but
We do.
Can you just tell us how long you've been there and what you've been doing, and what brought you to Nashua?
Absolutely, yeah. So I've been with the division about 10 months. It will be 11 at the end of September.
Ooh, gonna have to have a party.
We will. October's the big 1-year anniversary since I came here. I came towards the middle of the pandemic response, and I was kind of thrust into my role because as FEP coordinator, which is what we refer to it, because public health emergency preparedness is just
It's
way
too
too
long.
long. I was shocked it fit on my business card, but my whole role is ensuring that the city of Nashua, as well as the 12 surrounding towns that make up the greater Nashua public health region, is prepared. They can respond to public health emergencies and recover, as well as mitigate any issues that come up during these responses. So I've just been working on that, primarily COVID, helping where I can with monkeypox, other outbreaks, public health related incidents, and a lot of the work is behind the scenes for that preparedness aspect, which leads us into September.
So before we get to September,
Yep.
Which we're in, we talk about emergency preparedness and the role of public health plays in it, and the role that you obviously play. And you said you were thrust into it during COVID, because what we have done throughout the last 2 years and learned is how to even be better prepared in case there is yet the next health event. It
Absolutely.
may not be a pandemic, it may be an outbreak like we're having with monkeypox.
Yep.
But one of the things you do, and I do some of it with you, although I let you do most of it, is just making sure we have the right supplies in stock, making sure that if we have a clinic, that we have the right volunteers for it, and that we can register people and all of those things. So
Yeah.
literally you were thrust into this because I think within 2 weeks of you arriving, we were doing a booster clinic, or within a month.
Yep, within the first month. I remember my first week, I was on call after call with the state, with the CDC, local regional partners, and we were planning one of our first Elm Street clinics for children.
That was right. It was a pediatric
Yep,
clinic.
it was the pediatric clinic, and then right after that, we jumped into the Booster Blitz series, and it was quite interesting to take what I had learned during schooling and my time working in other places of public health, and moving those learned skills into the role of emergency preparedness.
Yeah, and you had done some of that prior to that while you were doing your job for your MPH.
Yes.
But we really threw you into the action there, because
Yeah.
we had that Elm Street clinic, which was a big clinic. It was our
Yes.
kids, and it was a different audience, and we were even accustomed to vaccinating. And then we combined that with boosters because they came out at the same time.
Yep.
So it was an interesting couple of days there.
Yeah,
but
an
it's good.
interesting first 10 months.
Yeah. But we feel, I know I do, I feel much better equipped to deal with what comes next than what we had to deal with kind of on a very quick basis with COVID-19.
Yeah, a lot of lessons learned from the federal level all the way down to the local level.
Right. And
Yeah.
so, and we're kind of looking back right now, trying to figure out what we can do better next time.
Absolutely.
Well, we're already in the next time, because we're
Yeah.
already dealing with monkeypox and what that response is.
Yeah.
And I will say, I do think people have learned a lot from the COVID experience. It's unfortunate we were building the plane as we were flying it, but
Yeah.
that's okay.
Yep.
We did it. So enough about that, because everyone gets tired of talking about COVID. Let's talk about Preparedness Month
Yes.
and the steps that people need to take in order to be prepared.
Sure.
And you know, getting back to school, it probably is a great time to reassess, to talk to your
Absolutely.
kids and about, you know, different things that are going on. So the first thing on the list is making a preparedness kit.
Yes. Yeah, so making your kit is tremendously important, and there's primarily 3 types of kits that we talk about in the preparedness field, so to speak, whether public health or otherwise. It's your home kit or your stay-at-home kit, your go bag or a car kit, so to speak, if you have to pretty immediately up and leave for flooding or some other event, and then actually a work or school kit. A lot of people tend to make 2 kits, and if they do that, I recommend the home kit and the go kit because you can use your go kit in your place of work or school.
Yeah, I think I would have to do that.
Yeah.
I'll be lucky if I make one, so.
Yeah, not everyone, and as we'll get into later, a lot of it is about finances. It's about what you can purchase depending on where you are. We're fortunate in Nashua. We have a lot of stores where we can buy the supplies, and a lot of people have them already in their house. But still, it's a big financial commitment to make 3 kits. So I always recommend start with your home kit, then move to, and if you can make your home kit easily adjustable into a go kit, you know, I'll show in a moment here a backpack that the division has as an exemplar of a go kit that can be used at home and as a go bag or an in the car kit. If you can make a home kit that's also easily movable into a vehicle, that's the best option.
And I will attest that you, Patrick, actually have a kit in your car.
I do.
I was very happy that I had a battery charger and 2 things of water, but you know, it's true. You are very prepared. You live and breathe preparedness, so I'm just vouching for you.
I do. Well, I appreciate that.
Yeah. So tell us what's in the kit. I have a little picture, and I don't want to jump ahead, but I'm going to.
Sure.
Because I see like toilet paper. Now, how
Yes.
funny is that? Because
Oh,
we
yes.
all had a shortage during COVID, so that one roll we really would just be very temporary for maybe a temporary power loss or whatever it is.
Yes.
And then the other big thing I see in all the pictures when I was looking online is water.
Yes. Yep. Yeah. So here's an example of the kit. This is just a backpack. So like I said, you can leave this in a corner of your house, or if you need to leave, you can take it, and go. So we'll break into the kit very briefly. When we first open it, this is a little first aid kit.
Yeah, we're really repping the brand
more,
today.
We are, yeah. You know, just a very simple, I call it a boo-boo kit.
Yeah.
You know, Band-Aids, things like that. But for starting out, you know, any first aid kit will do. We have work lights. I won't go into, you know, everything in detail. We do offer classes if people want to learn about this kit and more information. Work gloves. I have pens and Sharpies in here. A big thing we'll talk about in a moment is an emergency action plan. Making a kit, or excuse me, making a plan. This is almost as important as making your kit. I consider them the same level of importance. A notepad to go with the pen and Sharpie. Toothbrush, toothpaste, everyone's favorite duct tape.
It's a little bit like an overnight bag.
Kind of. And I will say, you mentioned the toilet paper.
Yeah.
This is always a big laugh in our classes, but it's really important. I have food in here, a water container.
What kind of food do you have in there?
Well, if we are not sponsored by this brand, but it's lemon pepper tuna salad with crackers. And the reason I got this, to go a little bit into learning about what's in your kit, is this container is an easy open. It has the little tab. Because if it didn't, I would have to have a can opener in here, which adds another item and more weight.
Okay.
So kind of an interesting thing as you're going through your kit and building it.
So make sure you can open whatever it is.
Exactly.
Like if it's a can of beans or tuna or whatever it is, make sure it's got that little handle on the top.
Yep, or you bring a can opener. But one thing I like to mention, you know, obviously this kit didn't cover everything. We have this bag here that we offer at the division, again, repping the division brand. And on the back here, it gives an example of, again, some emergency supplies and the lists that go with it, as well as some tips and tricks, so to speak. But these are a jumping off point, I like to say. Ready.gov has an additional paper. It's two-sided here, and it gives some added ideas of what to put in your kit. And even this is a jumping off point, as I say. And the reason I say that, the kit that we made cost $11.25.
Wow, that's great.
That's it. And we did that purposefully. This is an exemplar of what people might be able to purchase in 1 month. When we teach this class, we always discuss everyone's financial situation is different, right? Some people might be able to take $200 a month, and you save that for 5 months. You can go online and buy a $1,000 pre-made Go kit. And they certainly sell those online, and if that's how people want to do it, go for it. You know, feel free. But a lot of people, they can't do that. They have $10 a month that they can spare, $5, you know, maybe $25. So my big thing about preparedness is it's what you can achieve, right? It's what you can make it. So if you can only buy duct tape 1 month, buy that duct tape. You're more prepared than you were last month. Look around your home. You know, people. We offer. I know we offer free pens at almost every event we go to.
Right.
You know, take that pen, put it in your kit, so you have a writing implement. Building a kit is huge, and just as important is knowing what's in your kit. You know, taking the time once a month, go through it, look for expiration dates, make sure that you're cycling out your water. FEMA recommends a minimum of 3 days of water per person and per animal.
Oh, now they
in
would
your
get heavy
house.
in my house.
Well, it would get heavy in a go bag, absolutely. Yep, so in a go bag, maybe instead you would have water purification tablets and a filtration device. You know, some things get a little more technical, and there are trainings that you can take. You know, I don't want to sponsor any one of them, and there's a bunch out there, but people can Google, you know, kind of preparedness trainings. There's YouTube channels, there's courses you can take online, but just the very basics, it's so important, so important.
So you mentioned like you did it for about $11,
Yeah.
and I know that one day you did shoot a video on how to do this.
I did,
and
a
you
TikTok.
went to the dollar store, and it went, you know, a dollar store,
Yep.
and found most of the stuff there.
Yeah.
So, I mean, that's like just another option. They even have the cans of beans or the cans, you know, like you said, just
Exactly.
pay attention to how you're opening it.
Yep.
But if you can do this, especially now, because it is September, before we get into the winter months, it's
Yes.
nice to be prepared before the emergency occurs.
It
You know,
is.
if your power goes out or you can't stay in your home, like you said, flooding, you know, hopefully we get some rain. I don't want to get too much rain.
Yeah.
But we did have quite a bit in the last several days. So,
We did.
and it was more than the ground could absorb. So you just never
Yes.
know when those emergencies are going to happen. So you want to have one of these at home,
Yep.
one of these in your car. I'm feeling like a little shamed. I think I'm going to make one for my car.
We'll work on it
Yeah.
together, Jane. And
I think I know where I can get one of these.
yeah. And then, like I said, the other big thing is making your plan.
Yep. So you have this here. This one's out of the bag,
Yep.
right? So
Yes.
I'll give you that one.
Yep. So this is an example. The division made this in partnership with a bunch of other organizations, both internal to the city and external. And it's the My Emergency Action Plan. Now, when it says my, it really means mine and my family's.
Right.
You know, so this goes through 3 major ideas: making your plan, building a kit, and staying informed. And if people want to download a PDF that they can fill out of this, they can go on the NashuaNH.gov website, and under the Division of Public Health and Community Services, it does take a little bit of clicking, but you can find this and download a PDF. We're also currently, for the month, we have a table at the Nashua Public Library, and there's a paper there with a QR code. And if you scan that with a smartphone, it will actually bring you directly to the PDF downloadable emergency action plan online. But this is just as important as the kit, because if you don't know how you're going to be prepared for an emergency, your kit isn't going to do you much good, because you don't know how to use it, where you're going to go, who you're going to call, how you're going to stay informed with emergency alerts.
And part of what I was reading about too, it's like part of that plan is the communications plan.
Huge.
Which is
Yep.
really important when you have kids.
Yes.
Or you're living with someone that's elderly. You want to get in touch with them. I know, like for fires and, there's always like a meeting place that's
Yes.
outside of the home.
Yep.
For my family, it's like at the mailbox. But just to have that conversation with your kids
Yep.
or whoever's living in your house
Yep.
about how we're going to communicate.
Yep.
Or do you have a group text? Maybe those get too junky and busy.
Yes.
But how are you going to get in touch with one another
Absolutely.
if there
Yep.
is a problem?
Yep, and having an out-of-state contact is a big thing as well that we prioritize, because if there's an emergency statewide, you might have to leave the state, go stay with a relative. So having that out-of-state contact is also really important too.
That's a good point. Or out of county. If
Out of
it's
county,
not-
sure.
You
Yep.
know, some people have not left the state, so
That's
they
true.
might
Yep.
not be leaving. So if you want more information on how to make your plan, whether it's a communications plan, whether it's your general plan for your family, and these also, I'd like to give a little plug for these. These are customizable. We have
are.
different inserts for
Yep.
the elderly, for families, for individuals, and what was the other one that's in there?
Chronic conditions.
And for those with chronic conditions,
Yep.
which can be very important. If you
Absolutely.
have COPD, for example, and you're using oxygen 24/7,
Yep.
and the power goes out, you need to have a plan of what you're going to do, whether it's portable oxygen, how do you get in touch with that electric company,
Yeah.
or where can you go for a different power source. So all of those things are really essential for safety and good health.
Absolutely.
So you can go to ready.gov/plan. So you mentioned that you're going to be at the library during Preparedness Month. And,
Yes.
and what else do we have planned at the division?
Yeah, so a lot of our stuff is related to communication. So we are partnering with the City of Nashua's Office of Emergency Management. So each week they'll be posting social media or posts on different social media sites. Really all the big ones: Facebook, Instagram, Twitter, and we'll be sharing those. The mayor was very kind and actually made a proclamation to celebrate National Preparedness Month because of how important it is. Unfortunately, I forgot it. If anyone wants to see it, it's sitting at the division, 18 Mulberry Street, so they're welcome to come in and see it, and we can have a conversation about emergency plans and kits, whatever you'd like. So we were able to have that, and then throughout the region, since we're not just in Nashua, we're throughout the region, we've reached out to our libraries, and they're also promoting similar materials that we are in Nashua related to preparedness. So a big kind of online campaign, and then we're still active with our volunteer groups. We're having meetings with them, getting different trainings set up, things like that. So.
Right, we have a
lot
city
of
emergency
stuff.
response team.
Yep,
The
yeah,
CERT
the CERT.
volunteers.
Yep, yeah, and then we have some medical volunteers. So with the city is, we are prepared, and it's really comforting to know.
Yes, it is. Well, thank you, Patrick,
Absolutely,
for
Jen.
coming on the show and talking to us about preparedness. Very important topic, and I
Yeah.
appreciate you giving us some of your time today.
Yeah.
And I'm just going to remind our audience that we have a sexual wellness clinic on Thursdays from 3 to 6 p.m. That's at 18 Mulberry Street. It is by appointment, so please call 603-589-4500 and press option 2. We also have other health clinics during the week. We have immunizations on Tuesdays and Fridays, 4 to 7 on Tuesdays, and Fridays 9 to noon. And we have lead testing on those same days. So if you are suspecting that your child may have been exposed to lead in your building, in your housing, or otherwise, please come to the division and start that testing. And I'm going to remind you again, because I do it every time, to get fully vaccinated, and that's your children's vaccines. Protect yourself and those you love. Kids are going back to school. People are going to be inside more. The weather's going to get colder. Now is the time to act. And also Sundays, we want to promote this while the weather's still good. We have the Nashua Farmers Market, 10 a.m. to 2 p.m. at City Hall Plaza. And that's all we have for you folks. So have a great week, and remember that public health matters.